Good morning to all of you. So today we are going to study a new topic that is rheumatic fever and rheumatic heart disease. This is a very important topic. In many of the question paper you have got questions on how to assess rheumatic fever, what is Jones criteria, what is the major criteria, what is the minor criteria. In many of the question paper you have got this topic. So please listen it very carefully and learn the topic well. Now I would like to start with a case scenario so that you can understand what is rheumatic fever. Okay. So this is a case scenario. Jane was having a hard time during her ballet lessons. She did not seem to be as dainty and flawless as she was before. There were jerking, uncontrolled movements felt during the practice. She also started noticing unusually red spots from her torso and various areas of the body. What triggered Jane's mother to have her consulted was Jane complaints of pain in various joints of her body, and the doctor's diagnosis of rheumatic fever has hindered Jane from becoming a ballerina. Okay, तो इससे आपको क्या समझ में आ रहा है कि Jane is a girl who is practicing her ballet classes. ठीक है, तो बैले क्लासेस में हमको मालूम है फाइन मूवमेंट्स रहता है, लेग्स का, हैंड्स का, सबका फाइन मूवमेंट्स रहता है. तो उसका क्या कंप्लेंट्स था? शी वॉज नॉट फ्लॉलेस, जैसे पहले आसानी से कर पा रही थी, नाउ दिस वॉज नॉट देयर. सेकेंड थिंग, जर्किंग मूवमेंट्स था, अनकंट्रोल्ड, ऐसा मूवमेंट्स जो कंट्रोल नहीं कर पा रही थी, विच वॉज नॉट अंडर हर वॉलंटरी कंट्रोल्स, ऐसा मूवमेंट्स था. तीसरा उसने क्या नोटिस किया कि देयर वर रेड स्पॉट्स ऑन टॉर्सो मतलब उसके बॉडी में अलग अलग एरिया में रेड स्पॉट्स था. ओके, फिर दूसरा देयर वाज पेन इन वेरियस जॉइंट्स. सो दीज आर द कंप्लेंट्स एंड व्हेन शी वाज कंसल्टेड, when she was seen by a doctor, the doctor diagnosed her as rheumatic fever and that's why she could not become a ballerina. Okay, तो इससे आपको थोड़ा कुछ आइडिया लग गया होगा क्या क्या इससे समझ में आ रहा है कि अनकंट्रोल्ड मूवमेंट्स हो रहा है. सेकेंड इज देयर आर रेड स्पॉट्स. थर्ड इज देयर आर जॉइंट पेन्स. ओके, सो दिस कीपिंग दिस इन माइंड वी आर गोइंग टू स्टडी अबाउट rheumatic fever. Okay, now what is rheumatic fever? It is an inflammatory disease that can develop as a complications of inadequately treated strep throat or scarlet fever. Okay, rheumatic fever, what it is a inflammatory disease. कब होगा? When it is a complication of inadequately treated strep throat. strep throat मतलब streptococcus infection से हुआ वाला strep throat. If you don't treat it properly or if you have scarlet fever. Scarlet fever is a type of fever which is also called by streptococcus. Okay, so even if you have a scarlet fever or even if you have a streptococcal sore throat which is caused by streptococcal bacteria, and if you don't treat it तब उसके कारण rheumatic fever हो रहा है. आपको बात समझ में आ रहा है? So you have a streptococcal infection in the throat or the child may be a case of scarlet fever. If these are not treated adequately, then the person can have or the child can have rheumatic fever. Okay, so rheumatic fever is a systemic illness that occurs following group A beta hemolytic streptococcal pharyngitis. Okay, that is इसलिए हम GABHS. Okay, so that is group A beta hemolytic streptococcal pharyngitis. Okay, so it is a systemic मतलब बॉडी में अलग अलग पार्ट्स में. अभी हमने जेन का स्टोरी पढ़ा. Okay, so all these symptoms are there which follows pharyngitis caused by group A beta hemolytic streptococcal infections. Okay, so this part I have already told you the streptococcal throat or the scarlet fever are caused by streptococcus bacteria. ठीक है, तो अभी आपको क्या समझ में आ रहा है? What we have understood is the child will have a history of sore throat and this sore throat is caused by group A beta hemolytic streptococcus. Okay, which is a bacteria. Okay, and if this is not treated then the child can suffer from rheumatic fever. Okay, now we shall study about pathophysiology. The organisms attached to the epithelial cells of respiratory tract and produce a battery of enzymes which allows them to damage and invade human tissues. ठीक है. Now these streptococcal infections, they have, what they do is, we know that throat infections are usually spread by droplet infections. ठीक है. Droplet infections कैसे होगा? Suppose a child is there, we will name him as A. Okay, A child is having throat infections, maybe due to group A beta hemolytic streptococcal infection. So if this child sneezes, coughs or spits, okay, तब क्या होगा? The infections through droplet infections are traveled. ठीक है. तो finally दूसरे person के throat में चले गया. Okay. Now what happens is it will attach to the epithelial cells of the respiratory tract. हमको मालूम है कि the uppermost layer is the epithelial cells. Okay, so these organisms, what they do is they attach to the epithelial cells of the upper respiratory tract, and what they do is they produce a large number of enzymes, and based on these enzymes, this causes damage and invasion to the human tissues. डैमेज का मतलब क्या है? डैमेज कर दिया. इन्वेड मतलब अंदर घुसना. ओके, तो फर्स्ट स्टेप क्या है? अटैचिंग इटसेल्फ टू द एपिथेलियल टिश्यूज ऑफ द रेस्पिरेटरी ट्रैक्ट. सेकेंड इज डैमेजिंग द टिश्यूज. थर्ड इज वंस इट इज डैमेज, आसानी से अंदर चले जाता है. इट इन्वेड्स. ओके, सो नाउ देयर इज अ इंक्यूबेशन पीरियड ऑफ 2 to 4 days. Now what is incubation period? Incubation period, if you remember, it is the time period between the entry of the microorganisms and the exhibition of signs and symptoms. उसको हम क्या कहते हैं? Incubation period. Okay, so after the incubation period of 2 to 4 days. Now what do you mean by this? Suppose today somebody sneezed and streptococcal group A beta hemolytic streptococcus has entered into the upper respiratory tract of another child. Okay, today it has entered. So after 2 to 4 days, what will happen? The invading organisms elicit acute inflammatory response, and within 3 to 5 days of sore throat, fever, malaise, headache and elevated leukocyte count. Leukocyte किसको बोलते हैं? WBC. Okay, so these are the sign and symptoms. आज invade किया 2 to 4 days में, the child will have sore throat, fever, malaise, headache and if you take the WBC count, that will be high. ठीक है. ये स्टेप आपको समझ में आ गया. फर्स्ट इज अटैचिंग इटसेल्फ टू द epithelial cells of upper respiratory tract. Second is production of a large number of enzymes by the bacteria. Third is damaging the local tissues. Fourth is entering inside. ठीक है. Now next step is incubation period of 2 to 4 days. After that, the signs and symptoms will be sore throat, fever, malaise, headache and elevated leukocyte count. Okay. Now in small percentage of patients, infections lead to rheumatic fever. Not all children who have the sinus symptoms have rheumatic fever, but in some percentage, small percentage, this infection is there. Okay, and only infections of pharynx have shown to initiate or reactivate rheumatic fever. Okay, so we have several structures in upper respiratory tract. But if group A beta hemolytic streptococcus affects the pharynx and if it is not treated, this is seen to cause this rheumatic fever. Okay. Now direct contact with oral or respiratory infections transmit the organism that I have already told you that this transmits through the droplet infection, and directly means if 2 children are there in the house, one child is suffering, there are chances that the other child will also suffer. Why? Because there are chances of direct contact with oral or respiratory secretions. Second is crowding enhances transmission because people will be living close by, so the chances are there that one person may infect one child may infect many children. Third is patients remain infected for weeks after symptomatic resolution of pharyngitis and may serve as a reservoir for infecting others. Now this is a very dangerous thing. For example, बच्चे को हुआ and pharyngitis was there, उसका symptoms solve हो गया. ठीक है. Suppose if this is a child of rheumatic fever, this child will have the potential to transmit the infection to others. Okay, even after pharyngitis is okay. Pharyngitis सब इसको sore throat नहीं है, swallowing में कोई प्रॉब्लम नहीं है, फीवर अभी नहीं है, ठीक है, everything is okay, but till this child can transmit infection to others. Okay, even though symptoms are not there, but still this may act as a reservoir for infecting others. Okay, now severe scarring of the valves. Okay, what happens in rheumatic fever is valves are affected. Okay, valves of the heart, we will be studying which it is. Severe scarring of the valves develop during a period of months to years after the episode of acute rheumatic fever. So once a child suffers from acute rheumatic fever, it's not only during that particular time, but the problems can occur maybe months, maybe years after that episode of acute rheumatic fever. And sometimes there can be recurrent episodes, and this recurrent episodes may cause progressive damage to valves. उसका मतलब क्या है, अभी बच्चे को rheumatic fever हुआ, अभी ठीक हो गया, ओके, और मे बी दिस सोर थ्रोट हुआ, अभी हो गया, ज़्यादा कुछ प्रॉब्लम नहीं हुआ, बट आफ्टर मे बी मंथ्स और मे बी ईयर्स then rheumatic fever comes again. Okay, and valves are affected. So once you have recurrent attacks of rheumatic fever, the problem is the valves of the heart continues to be damaged more and more. Okay, now which valve is more commonly affected? Mitral valve is most commonly affected in 65 to 70% of the people, and aortic valve is second common, that is 25%. ठीक है, अभी आपको समझ में आ रहा है? Can you see this? Okay, ये बच्चे का दिस इज, अभी मैं आगे आपको और स्लाइड्स दिखाऊंगी. दिस इज, अभी मैंने फर्स्ट सिनेरियो दिखाया था रेड स्पॉट्स. आई वाज टॉकिंग अबाउट रेड स्पॉट्स. नाउ दीज आर द रेड स्पॉट्स इन द टॉर्सो. ओके, तो ये सब में दिख रहा है, दीज आर द रेड स्पॉट्स. ओके, तो अभी हमने क्या पढ़ा, दैट आफ्टर rheumatic fever can have repeated episodes. The valves, severe scarring of the valves is there. I will show you the diagram of it. Okay, and mitral valve is most commonly affected in 65 to 70% of the people, and second is aortic valve, which affects 25% of the people. Okay, now can you see this? This is a typical tonsillar exudate on a culture positive case of streptococcal pharyngitis. ये आप देख रहे हैं, तो आपको क्या करना है, सिर्फ एक ask the child to open the mouth, use a tongue depressor. आपका टंग यहाँ डिप्रेस होगा, तो this is the pharynx which is acutely inflamed, and these are the symptoms of, this is culture positive. ठीक है, ये बच्चे का जब थ्रोट कल्चर लिया, so this was positive for streptococcal pharyngitis. Clear up हो गया? So this is how a strep throat looks like. Okay, that is why I put this slide so that you can understand how does a strep throat look like. अभी आपको समझ में आ गया. So हम लोग naked eye से भी एग्जामिन कर सकते हैं. You can judge that these are the symptoms. आपको सिर्फ एक throat culture लेना है, send it to the microbiology lab, and then you will get a report. Okay. Now what are the statistics? Okay, rheumatic fever is most common किस में? In the age of 5 to 15 years children. Okay, but this can also occur in young children and adults. Okay, rheumatic heart disease is less than 0.05 per thousand population, and there were regional outbreaks in, these are Tennessee, Utah, Ohio, Pennsylvania. So these are different places of US where there were short outbreaks. Okay, earlier. Now however, now the cases are increasing. Okay, so rheumatic fever in 2001 to 2011 showed that it has steadily increased, and 2005 it was maximum, then it has decreased thereafter. So we don't have a fixed trend. It sometimes increase, it sometimes decrease, and this is the statistics. Okay, now worldwide there are over 15 million cases of rheumatic heart disease with 282,000 new cases and 33,000 deaths from the disease each year. This is the global scenario. ठीक है, 15 million cases of rheumatic heart disease with 282,000 new cases and 33,000 deaths from this disease each year. Okay, and this is a major cause of morbidity and a major cause of mitral insufficiency and stenosis in US as well as in the world. अभी हमने पढ़ा, the mitral valve in rheumatic heart disease is affected in 65 to 70% of the people. Okay, so so that is why, because of this, significant morbidity is there. Okay. Now native Hawaiians and Maoris, both of Polynesian descent, have a higher incidence of rheumatic fever. ठीक है, वहाँ हमने क्या पढ़ा था 0.05, यहाँ पे 13.4 per lakh hospitalized children per year, even though they have taken antibiotic for streptococcal pharyngitis. ठीक है, सो ये there is a native Hawaiians and Maori, ये population में what it was found that there it was 0.05, but here it is 13.4 per 1 lakh hospitalized children, even though they have been treated with antibiotic for streptococcal pharyngitis. Okay, now males and females, it is same, there is no difference. Okay, and females with rheumatic fever fare worse than males and have a slightly higher incidence of chorea. Now what is chorea, मैं आगे आपके स्लाइड्स में बताऊंगी. ठीक है, now number wise both are same, but if you take the prognosis, you will find that prognosis of the female children is worse as compared to male children. Okay, second thing is chorea. Okay, it is a type of involuntary movement. Okay, so that is higher in girls as compared to boys. So commonly median age is of 10 years, and it is very uncommon in less than 3 years, and it is extremely rare in younger children in industrialized countries. So these are some of the statistics related to rheumatic fever. Okay, now what are the causes? Rheumatic fever is believed to be a result of autoimmune response. What do you mean by autoimmune response? Our own body cells, they fight with our own body cells. Okay, so this is internal fighting, so that is called as autoimmune disease. Okay, so it is believed as a result from autoimmune response, but however the exact pathogenesis is not so clear, but we have these two major things, that is what we are going to discuss. First is group A, beta hemolytic streptococcal infection, that is the most common cause. So we have already studied that rheumatic fever occurs only in those children who have been affected by group A beta hemolytic streptococcal pharyngitis, and only infections of pharynx initiate or reactivate rheumatic fever. ठीक है, ये पहला हम लोग ने पहले पढ़ लिया. We are repeating the same thing, that the major cause for this is, first is it is believed to be an autoimmune disease. Second is it is those children who are affected by group A beta hemolytic infection in pharynx, and if it occurs again, then also rheumatic fever can occur. Okay, third is molecular mimicry. Mimicry मतलब एक के जैसा दूसरा सेम करना, that is called as mimicry. ठीक है, so called molecular mimicry between streptococcal and human proteins is felt to involve in both B and T cells of the peripheral blood. Okay, problem क्या है, streptococcus का प्रोटीन और human beings का प्रोटीन, they are very similar, the molecules are very similar. Okay, so that is the problem, the molecules are very similar, and that is why they fight with each other. Okay, so they are very similar, and they involve in both B and T cells of peripheral blood, and infiltration of the heart by T cells. Okay, okay. Our third reason is there is a molecular mimicry between streptococcal proteins as well as human proteins, both the B cell as well as T cell. ये हमको मालूम है, these are related to our immune response. Okay, we have cell mediated as well as humoral response. Okay, so it is related to immunity. Okay, both B cells and T cells of the peripheral blood, and it is seen that T cells they infiltrate the heart. Okay, so we have studied that the mitral valve is affected, so T cells are responsible. Okay, now is some believe that increased production of inflammatory cytokines, okay, इसके साथ में whenever you have immune response कई चीज प्रोड्यूस होता है, तो one of them is inflammatory cytokines, okay. So it is a final mechanism of autoimmune reaction that causes damage to cardiac tissue in rheumatic heart disease, ठीक है. तो मैं अभी रिपीट कर रही हूँ. What are the causes? First is it is believed to be a result of autoimmune response, but we don't know the exact cause of it. Now it has been seen that those children who have pharyngitis caused by group A beta hemolytic infections, and if they have repeated infections, then rheumatic fever occurs again and again. Third thing what we have found is there is a molecular mimicry between human proteins as well as the proteins of the streptococcus, and it affects both the B lymphocyte and T lymphocyte, and T lymphocytes affects the heart. Fourth thing, it is believed that there is increased production of inflammatory cytokines, okay, and this inflammatory cytokines causes the damage to the is the final mechanism of autoimmune reaction, and they damage the cardiac tissue in rheumatic heart disease, okay. I think you have understood, ठीक है. पहला चीज it is thought to be autoimmune. autoimmune का मतलब क्या है? हमारा बॉडी का सेल्स हमारे ही बॉडी के सेल से लड़ाई करना. नहीं तो यूजुअली क्या होता है, सपोज हमारा जो इम्यून मैकेनिज्म है, दे whenever they identify foreign things, तब अटैक करके they have a immune response, okay. पर यहाँ पे क्या है, own cells. why it is so? क्योंकि ग्रुप है बीटा हेमोलिटिक स्ट्रेप्टोकोकस का प्रोटीन्स और ह्यूमन बॉडी के प्रोटीन्स, दे आर वेरी सिमिलर, ओके. सो दैट इज व्हाई दे इनिशिएट रेस्पॉन्स, एंड दिस अफेक्ट्स द बी सेल्स एंड टी सेल्स, ओके. बी सेल्स एंड टी सेल्स which are a part of immune system, और T cells जो है हार्ट के मसल्स को अफेक्ट करता है. वी नो द mitral valve followed by aortic valve is affected. इसके साथ में there is release of inflammatory cytokines, और ये inflammatory cytokines जो है autoimmune response को बढ़ावा देता है, and this damages the cardiac tissues in rheumatic heart disease, ठीक है. So this is in short what are the causes of rheumatic fever. Now what are the clinical manifestation? मैं आगे आपको स्लाइड्स दिखाऊंगी, ओके. What we now have is modified Jones criteria, ठीक है. पहले हमारे पास Jones criteria था, but now it has been revised. In Jones criteria we have two groups. One is a major criteria, second is the minor criteria, ठीक है. क्लियर है? Jones ने criteria बनाया है based on some symptoms, okay. Major criteria, minor criteria. Rheumatic fever कब बोलेंगे? First is if it is presence of two major symptoms है rheumatic fever, or one major and two minor. एक major criteria और two minor, और there are three minor, ठीक है. ये तीनों में से कुछ भी हो तो then the child is labeled as case of rheumatic fever. क्लियर है? Either it is two major criteria, second is one major plus two minor, 1 plus 2. First is two major, second is 1 plus 2, 1 major plus 2 minor. Next is 3 minor, okay. तीनों में से कोई भी स्थिति हो, then it is then we consider it as a case of rheumatic fever. Can you see this? Just देखो fever है 100.8 to 102 degree Fahrenheit. This is erythema marginatum जो मैंने आपको दिखाया था. It's a non-itchy rash, मतलब खुजली नहीं है, but still this type of red spots are there. Narrowed mitral valve causing heart murmur, ठीक है. I will show you a detailed diagram. These are the painful joints, okay. These are the signs and symptoms of rheumatic fever, okay. Now this is the major diagnostic criteria. First is C, okay. Carditis. Carditis in the child may be clinical or subclinical. क्या मतलब है? क्लिनिकल मतलब कार्डिटिस का आपको साइन एंड सिम्टम्स दिखाई दे रहा है, और इट में भी सब क्लिनिकल. इकोकार्डियोग्राम किए तब पता चला कि चाइल्ड इज ए केस ऑफ कार्डाइटिस. सेकेंड इज पॉलीआर्थराइटिस. पॉली मतलब एक से ज़्यादा, ओके. आर्थराइटिस, सो यू हैव swollen joint, एक से ज़्यादा joints is affected, okay. It can be monoarthritis or polyarthralgia are adequate to achieve major diagnostic criteria in moderate or high risk population, okay. So अभी हमने Hawaiians का पढ़ा था, where they are more at risk as compared to others. Okay, so there even monoarthritis can be there, but usually it is polyarthritis. Multiple joints are affected. Arthritis मतलब painful joints. Okay, they are. Third is chorea. Okay, jerky, uncontrollable body movements. Okay, जर्क के साथ है, झटके के साथ हो रहा है और बॉडी मूवमेंट्स को कंट्रोल नहीं कर सकते. आई विल शो यू स्लाइड्स ऑन दैट. इसको हम दो नाम से जानते हैं. वी हैव सिंडेनहैम्स कोरिया और इट इज कॉल्ड एज सेंट बीटस डांस. ओके, इट इज कॉल्ड एज सिंडेनहैम कोरिया. It is also called as St. Vitus dance. Okay, this occurs more common in hands, feet, and face. Okay, so you have uncontrollable movements. अगर आपको केस सिनेरियो याद होगा, there were uncontrollable movements. So these uncontrollable movements can occur in hands, it can occur in face, it can occur in feet. Okay, next is subcutaneous nodules. हम लोग डायबिटीज में सबक्यूटेनियस इंजेक्शंस लगाते हैं. ठीक है, so here you have subcutaneous nodules. Okay, so these are small painless bumps, मतलब nodules, छोटे छोटे गुठली जैसे. ठीक है, beneath the skin. स्किन के subcutaneous वर्ड से इनको समझ में आ रहा है. It is beneath the skin, but there is no pain. These are small. मैं आपको इसका डायग्राम्स दिखाऊंगी. ठीक है, next is erythema marginatum. Okay, so what you have is either it is flat or slightly raised painless rash with a ragged edge. उसका अभी मैंने आपको डायग्राम दिखाया था. या तो फ्लैट है रेडिश एरिया, या तो थोड़ा सा रेस्ड है, बट देयर इज अ फिक्स्ड बाउंड्री. रैग्ड एज मतलब क्या है, एक रफ एज है. ओके, तो अभी मैंने आपको डायग्राम दिखाया था. आई विल शो यू फॉर दैट. ओके, either it is flat or slightly raised painless rash. Okay, it is not itching also. It is a painless rash with a ragged edge. मतलब उसका जो बाउंड्री है वो थोड़ा रफ है. So what are the major criteria? First is carditis. Okay, carditis can be clinical or can be subclinical. Second is polyarthritis. ठीक है, polyarthritis मतलब more than one joint is affected. Third is chorea, that these are uncontrollable movements. कहाँ पर? hands में, फेस में और फीट में. ठीक है, थर्ड इज फोर्थ इज सब एंड दिस कोरिया इज ऑल्सो कॉल्ड एज सिंडेनहैम कोरिया. इट इज ऑल्सो कॉल्ड एज सेंट वीटस डांस. नेक्स्ट इज सबक्यूटेनियस नोड्यूल्स. देयर आर स्मॉल पेनलेस बम्प्स. these nodules are present beneath the skin. Next is erythema marginatum. These are flat or slightly raised painless rash with a ragged edge. Okay, and now ये देखो, ये है diagram. I think I put this slide just so that you can remember this child and you can remember the sign and symptom. ठीक है, Sydenham chorea अभी हमने पढ़ा. In 20 to 30% of the cases ये क्यों हो रहा? Because basal ganglia of the brain is affected, which causes spastic movements of the head, face and limbs, and this is also called as St. Peter's dance or Sydenham chorea. And in most cases it resolves in 2 to 6 months. Okay, it is a very long term disease. 2 to 6 months में ठीक हो जाएगा, but sometimes it requires physical therapy. Okay, chest pains can be there because of the involvement of the valves. See, this is erythema marginatum. दिखाई दे रहा है? This is the ragged edge. Now this can be flat or this can be slightly raised. Okay, a subcutaneous rash that does not itch. ठीक है, does not itch मतलब खुजली नहीं है. That forms rings and that spreads out over time. इसको ये सब आप साइज देखना है. ये छोटा है, ये उससे बड़ा है. ये छोटे से स्टार्ट होता है and gradually it becomes. देखो ये इसके पूरे टॉर्सो में these are torso and other parts of the body. Erythema marginatum is there. फिर ये देखो carditis. Okay, carditis in 50% of the cases the infection can spread to the heart and form. ये देखो, these are bacterial vegetation on the tricuspid valve. ये 3 cusp है इसमें. So that is why these are bacterial vegetation on the tricuspid valve. Okay, now ये देखो, these are the joints are affected. So these are the signs and symptoms. Now ये देखो subcutaneous nodules. Can you see this? ठीक है, इस टाइप के see, these are the joints which are affected. Okay, these are the subcutaneous nodules. Now ये देखो, ये normal mitral valve है. ठीक है, this is a normal mitral valve, but see this, when rheumatic mitral valve, this is how it is affected. Okay, so this is the difference which occurs in a rheumatic heart disease. So this is chorea. आप देख रहे हैं uncontrollable movements of the legs, face and hands, तीनों का है, ठीक है, face, hands, legs तीनों का, and this child cannot control the movements. Okay, so this is chorea. Now what is the minor diagnostic criteria? Minor diagnostic criteria is there is fever more than 38.5 degrees centigrade. Okay, then polyarthralgia is painful and tender joints, most often in knees, ankles, elbows and wrist. Third is prolonged PR interval. Okay, if you take an ECG, okay, there will be prolonged PR interval, and there will be increased ESR. So this is erythrocyte sedimentation rate, elevated peak erythrocyte sedimentation rate during acute illness more than 60 millimeter per hour, or a C-reactive protein more than 3 mg per deciliter. ठीक है, this is minor criteria. क्या क्या है? Fever more than 38.5, polyarthralgia, that is multiple joints are affected which are painful, as well as tender. Tender का मतलब क्या है? छूने से पेन. ओके, कहाँ कहाँ पर होता है? नीज में, एंकल्स, इट कैन बी एल्बोज और रिस्ट्स. Then is if you take ECG, the PR will be prolonged, and you will have increased ESR. कितना? More than during acute illness, मतलब जब sign and symptoms है, then it will be more than 60 more than or equal to 60 millimeter per hour, or C-reactive protein will be equal or more than 3 milligram per deciliter. Okay, so this is major and minor criteria. अभी हमने पढ़ा, ठीक है, either it is 2 major or it is 1 major and 2 minor, or it is 3 minor. Okay, ये these are the modified Jones criteria. Based on that, we diagnose the child as a case of rheumatic heart disease. Okay, now remaining things I will teach you, assessment, diagnostic, and all those things. I will teach you in the next class. Okay, so today what we have studied is, we have studied what is rheumatic fever, we have studied the pathophysiology, and we have studied the signs and symptoms in detail. Okay, so please remember these. This is a very important topic. I'm telling it again. Please don't ignore this topic. Study it well, because this is a very important question which has come in repeated question papers. Okay, so once this topic is over, I will surely take a test on rheumatic heart disease. Okay, so study well and stay safe. Thank you.